initially I wanted to scope the workforce and just see what kind of workforce was out there and what kind of support we could offer, and then worked out which nurses I was going to support, and I landed on supporting the newly qualified CNSs, or the people new in post, um, because I felt like they were the ones that needed the most detailed support from us. I now have 21 nurses that I support in that way, using the documentation that we're given through the project. There's also a group of universal support nurses that I support, and that's mainly structured around teaching, but also some interview preparation and some working with people preparing for becoming CNSs. I am providing coaching, so that's a large element of what I'm doing. So the work that I'm doing with the individual nurses is predominantly a mixture of coaching and mentorship. And I meet people on a fairly regular basis, and those sessions are quite clear coaching sessions. I'm also working with people within their clinical practice. So I'm working with people within their clinics, in their MDTs, and other elements of the CNS role. Is there anything different that you're doing?
So no, really similar to you, Liz. So I spent my first 5 weeks within the role, embedding myself in each of the different 5 hospitals, meeting all the key stakeholders that were involved within the CDR role. So lead cancer nurses, lead nurses, and then understanding the cohort of CNSs that I would be providing the enhanced CNS support for. At the moment, yeah, I have a similar number of nurses that I'm supporting, so around 20, and providing monthly kind of coaching, mentorship, reflective practice sessions for them. That could be attending clinical areas as well, MDTs, just to understand their roles, and then looking at embedding the Ascend framework with those nurses, and understanding their career development. Similar to you, in terms of the universal support, I'm providing teaching in 2 of the hospitals so far that is hopefully about inspiring nurses to come into the cancer CNS role, and other kind of less qualified or more qualified CNSs that may want developmental support as well.